Hello everyone. I'd like to show you how to discuss with relatives. Um, do not attempt resuscitations, DNR. This is really important topic. It comes in the exams, and I need to make it easy for you to demonstrate for you the whole scenario without the patient, but I will be like acting the scenario for you. And if you run it twice, you will be very confident in doing these stations if you had it in your exams. And if you like it, please just pray for Allah to make me success as well. Let's get started. So, hello, I'm Dr. Ahmed Al Hadi. Can you confirm your name, please? Um, John. Nice to meet you, John. So, just they said don't say nice to meet you in this situation. It's just because like actually it doesn't matter that much. But yeah, let's try to be more like sympathetic and start the tone of sadness from the start. So, Mr. John, can you confirm that you are the son of Mr. David? And may I also know if you are the next of kin? Mr. John, I'm here to discuss with you some issues regarding the care of your father. Is this okay by you? Do you need any family member or a friend to be present in this meeting just for support? Mr. John, may I know how much do you know about your father's condition? Yes, you are right. Your father has advanced heart failure, and also he has some background of dementia and high blood sugar and high blood pressure. And Mr. John, I'm sorry to tell you that your father's condition is deteriorating despite optimal treatment. How do you feel about it? I'm really sorry, Mr. John. I highly appreciate your feeling. This could be very hard for you. And I know this is like a very tough topic to discuss, but I'd like to discuss with you some another point regarding the care of your fathers. Mr. John, normally for anyone who is deteriorating, we need to have a clear plan about resuscitations. Have you heard about it? Let me explain it to you. Resuscitations is normally if a patient's heart stops beating, we do strong chest compressions, uh, and sometimes they may need electrical shocks to restart the heart beating again. And also some patient needs like tube to be inserted in their air pipe to help or to assist with breathing as well. And by the hopefully all this will restart the heart beating again. However, this resuscitations has lots of complications. This include like fractures to the ribs. They can get broken, and this could cause like injury to the lungs and internal bleeding. And sometimes the consequences could be really devastating. especially on vulnerable patients. Are you following me, Mr. John? So, Mr. John, taking into account the overall health of your father, and as you know, he's very vulnerable, and his disease now in advanced stage, as I told you. So the resuscitations is extremely unlikely to be successful in your father case. And even if it was successful, uh, it could lead to very unpleasant consequences, and your father may have a very bad quality of life. Are you following me? Therefore, the treating team has decided that do not attempt resuscitations further would be in the best interest of your father's condition. How do you feel about this? Yes, I totally understand uh, your feeling and appreciate your concern. But as I mentioned, in your father conditions, just resuscitations would do more harm than good. And we don't want your father to go through unnecessary suffering. And I'm sure you wouldn't like this to happen to your father, right? Yes. Therefore, do not attempt resuscitations will be in the best interest of your father conditions. No, so resuscitation doesn't mean that we're going, not attempting resuscitation. It doesn't mean that we're going to stop the treatment for your father, and we're going to give him all type of treatment that in his best interest. So how do you think? Okay, right. Thank you. So as I mentioned, we're going to give your father all the treatment it which will make him symptoms free and having comfortable life, and minimize his suffering as much as we can. So we're going to involve a group of specialists to take care of your father in these difficult days. And this include social worker to support with all the social needs, and also occupational therapist to make all the necessary adjustments to address any difficulties your father could have faced during his last days, and just to be able to manage the daily day-to-day activities without struggle. Do you have any concern, Mr. John? I'm really sorry for all this bad news. I wish I could have delivered a better news for you. Please don't feel all alone in this. We are here all to support you and to support your father. If you have any questions or any queries at any point, please feel free to contact us. We're going to give you our contact number to contact us if you have any concern or any question regarding your father care. And also, I'm going to give you some leaflets regarding the resuscitations, how it's done, and the risks versus the benefits. Hopefully, it will help you to understand it better. So thank you so much, Mr. John, for your time. And I'm really sorry. Uh, uh, and please just rest assured that we are not going to leave your father alone, and we're going to offer him the best care that uh, which will reduce his suffering and makes him have a good, like I would say, like just near life, normal life, like pain-free, symptom-free. We'll address all the symptoms he will have as appropriate. Do you have any concern? Any questions, Mr. John? So, Mr. John, just a few questions, if you don't mind. May I know with whom your father is living and if he's supporting anyone? Okay, thank you so much. As I said, the social worker will deal with all this. And thank you and bye.